I'm Andrew Clark, and I direct the Institute for the Municipal and Regional Policy at Central Connecticut State University, and we convene the Connecticut Reentry Collaborative. The collaborative is made up of 10 regional reentry roundtables throughout the state. And we started in roughly 2007 and have been going strong ever since. And as many of you may know, this is Second Chance Month. It's national. It's been happening for a number of years now. And we had planned to be at the Capitol on April 15th to bring messages of reentry reform to the Capitol. But as I mentioned, we are now doing this virtual. And it's a very different circumstance that we find ourselves in. So we've been trying to be responsive to not just reentry, but reentry during the time of COVID. And today we have on the agenda talking about racial and ethnic disparities in our health and justice systems. And we're going to be joined by some tremendous guests to start off the first session, which will run from roughly 10:05 to 10:35 a.m. And then the second session, we'll hear some voices from Connecticut family members whose loved ones are impacted by incarceration in the midst of COVID right now. And then have a session beginning at 10:40 on community voices, talking about disparity in Connecticut during COVID-19. And we'll be joined by State Representative Robin Porter, Tamara Lanier from the Connecticut AACP, and a few other invited guests. So I'd like to start off the first session now. As I mentioned, we're talking about racial and ethnic disparities in our health and justice systems. And I'd like to bring on Jacqueline Rabe Thomas, a reporter from the Connecticut Mirror. And she did a recent article, which we've shared with the audience, attendees, and you'll be able to find it on the website as well, about a week ago, I believe, which mentioned and did some reporting on health disparities relative to COVID. And it's an important, we felt it would be an important backdrop for the conversation that we're having. What's the information that we have now about disproportionate contact with COVID rates and the like? And so I'd like to bring on Jacqueline now to talk about her findings and bring us up to speed on where we are in Connecticut and how COVID is impacting our communities.
So I have done a few stories on the impact COVID has had on different populations in Connecticut. Recently, I did a story on the impact that it is having on minority communities. And so I'd like you to meet Francine Bailey. She is a Hartford resident. She has 4 children. She makes $33,000 a year working as a nursing assistant at a local nursing home in Windsor. And I'm going to just share some audio from her so you all can hear her tell her story. It's about 3 minutes long, so it's just really compelling, the portion that I have here. So
when I came home, I start feeling a slight bit of headache, but I thought it was my sinus. So Tuesday I was off. Same thing. Called my doctor. And Wednesday I called out from work because I didn't go to work because still having the headache. I think it was my sinus. So I called the doctor. I think it was Wednesday. When I called, I tell her what's going on. She prescribed, because I told her it's in my sinus area, my sinus pressure. So she prescribed the nasal spray. So then Wednesday, Thursday, Friday, Sunday, got a phone call from the administrator, Courtney Wood, that the resident positive for COVID-19. So she think I should go get tested. I work on the lock unit. Alzheimer's unit. So I called my doctor on Monday and Sunday. Called my doctor. They told me go get tested at the St. Francis Hospital. When I went, the place was closed. So I went back on Monday the 30th, got tested, waiting for the test. Then on Tuesday, I couldn't breathe. Before that, I get up, go to the shower. While I was in the shower, I found myself couldn't breathe. I just started hyping, ventilating, and I just started screaming for help. But it's like no one could hear me. Like no one in the house could hear me for help. And I just keep crying out for help. Nobody could hear me. But God gave me the strength. Get myself, go to my bedroom, get dressed, drove myself to the hospital. When I get to the hospital, told them that I was exposed to COVID at my job. They put me in right away. They do X-ray. They take blood. They come back. They said it's pneumonia. Sent me home. I come home. I drove to the grocery store, did some stuff, come back, make me some soup, take the pill. Then after I take the pill, didn't know I couldn't drink cold water. Drink some water, knocked the blood out of my body. Couldn't breathe. And this time my brother took me back to the hospital. When I went back to the hospital, they told me there's nothing they could do because I'm waiting for the test, so there's nothing they could do. I don't have a temp. They told me my oxygen level is good, vitals is good. So I came back home, still couldn't breathe. I was watching a video where I see the nurse, like the respiratory nurse, like beating on the back. So I had my baby father pounded on my back, and then I'd throw up, and I could breathe a little bit. Went in the shower, I did the same thing for myself, and I could breathe a little bit. I think it was Thursday. My doctor.
So that's Francine, who spoke with me about her experience about a week and a half ago now. And she is starting to recover a bit, but she's still struggling. She works at a nursing home in Windsor, and that nursing home has been hit particularly hard by COVID. The rate of folks in her nursing home, there have been over 30 deaths in her home. The state does not release how many people who work in these nursing homes have been infected with COVID. But with the over 30 deaths in her nursing home, that means that 1 out of every 7 residents has died in her nursing home. And this virus has hit particularly hard in nursing homes. And so let's look at, for a second, the types of people who are frontline workers, their demographics. And that's what this chart shows. It shows who we're talking about, who has the ability to work from home. I'm lucky, I'm able to work from home. Many people are not. And you can see white residents, this is nationwide data, white residents are 30% are able to work from home compared to almost 20% of Black residents. Hispanic residents, 16%. So it shows you who our frontline workers are. It also, race unfortunately also transcends wealth very often in Connecticut. And so if you look at, this is from the New York Times, they did a series of breakouts of different metropolitan areas. So this screen grab shows Fairfield County, the Bridgeport, Stamford, Westport area, and shows just how much people were able to stop moving when the stay-at-home, or not stay-at-home orders, but the public health emergency was declared and strong recommendations to begin social distancing. What you'll see right here is that the poorest 10% in that region of the state, which has been hit particularly hard by, that region of the state has been hit particularly hard by this, that there was a decline in people moving around, and this was all driven, this data comes from cell phone tracking. And so, but then once the work week started, people had to go back, and the wealthiest folks were able to remain socially distant. So they weren't, they're less likely to contract the virus. This shows the same thing across the country, where people are able to stay at home. The wealthier counties, or metropolitan areas rather, are more able to stay at home, and that's what this shows. And this is from a Reuters article. You can look up your county. Connecticut counties are somewhere in here, because again, it looks at Fairfield, but it also compares it with other lower income places in Fairfield, like Bridgeport and stuff. And Hartford has, Hartford and Bridgeport are some of the poorest communities in the country. So, and so this is a quote that stood out from Francine, the same woman that I just played her audio. She shared that people are dying. People are walking off the job. It's just too much. I was just doing my job, and not even one day to make ends meet, to take care of my family. Now I can't even be around my family. The data that I have down here is actually a little bit dated now, because I have found out that there have been over 30 deaths in the nursing home now. So when there was just 9 deaths in the nursing home, it was 1 out of every 15 residents. So the problem is getting worse. And this is just over a 2-week period. So let's see what the data shows of how hard this is impacting different communities. So COVID-related deaths for every 100,000 residents in Connecticut. So on April 10th, the governor's office, facing mounting pressure, I think it was the 10th, recently released data showing the racial and ethnic background of residents who are dying after contracting the COVID, as well as folks who have tested positive. So what you'll see here are folks who have tested, who have actually passed away after contracting COVID for every 100,000 residents. And what you'll see is that among the confirmed cases in Connecticut, there are, for every 100,000 Hispanic residents, 22 have died from COVID, or as related to COVID. White residents, it's 41, and Black residents, it's 57. So the data right now shows that Hispanic residents are less likely to die than white residents, but Black residents are more likely to die. And so I say all this with a huge caution of, when you see data related to COVID, that there are huge gaps in the data, and many things that don't tell us what's happening. So testing rates. There are concerns about how often people are able to be tested, and whether testing is available in certain communities, or whether immigrant populations, for example, feel safe going to be tested, or worry about the costs associated with testing. And so what the data does not show is how many people are tested, what their racial breakdown was, and whether it mirrors the state's population. It also doesn't show hospitalization rates. So it doesn't tell us how many people were hospitalized and were getting sort of the higher level of care, and what their racial breakdown was, and so that people can see whether it mirrors our demographics in Connecticut. And then I think the most important data gap is that the demographics of everyone who has tested positive or died after contracting the virus there's huge holes. So let me just show you how big the hole is for. These are residents who have tested positive for every 100,000 residents. And so if you look at the first three red bars, that's the data that the governor's office released. And so that will show you that Hispanic residents for every 450, there's 450 residents for every 100,000 Hispanic residents in the state who tested positive. So it looks like they're more likely to test positive for COVID. And same thing with Black residents. 549 for every 100,000 Black residents in the state, compared with white residents being 245 for every 100,000. But what the data doesn't show you is how many forms are being filled out without any race or ethnicity data being submitted to the Department of Public Health to compile this information. Oopsie. So that would add an additional 260 residents for every 100,000 residents in the state of Connecticut that we just don't know which of these buckets they fall in. So, I'm not a statistician, but I would say that's a huge red flag of who are those people? Were they in certain communities? Where people are unknown race or ethnicity? Connecticut's a very segregated state. Were those unknown cases primarily in the more affluent communities, or were they in the poorest communities? Because this could either, if those, or does it break down evenly across the trend lines that we're already seeing? So I do just urge caution for that. That aside, when it comes to the deaths, again, going back to this graphic, the race and ethnicity is known for about 96% of the known deaths. So that only adds about 2 deaths per every 100,000. So this data is strong, I would say. That doesn't cause as many alarms. But again, back to this point of who's being tested, who's getting treatment and hospitalization, that could be a huge factor in who's actually passing away. And so this is a quote that ran in the article that my colleague and I wrote from the Connecticut president of the NAACP, who said, if we don't have this information, how can we make appropriate decisions to prepare our community accordingly? So, as I was doing interviews for this, there were questions about whether there was implicit bias in hospitalization, whether there were, or in testing even. And so, to be fair, the governor's office has set up, or is in the process of setting up, quick testing options in some of these high incident areas. So in New Haven, I think yesterday a new one just became operational. There's another one that's going to soon be coming to Hartford, and another one in Stamford. I should note that Bridgeport is the largest community in the state of Connecticut, and it has the second highest testing rate in Connecticut as well. And so next, about this point about whether or not there is some decisions being made about who gets tested and who doesn't, and whether there's some implicit bias going on. This is a quote from a report that was done by Rubix in partnership with some professors at the University of Pittsburgh and Virginia. And it was done on 6 states and looked at different data points to see who came into the hospital with symptoms of different treatment that were COVID related, or what the researchers deemed could be considered COVID related, and whether or not they got a test or not. And this was their conclusion. As the number of infected patients increases drastically, patients identified and access to testing options is paramount. Unfair rationing within distinct neighborhoods may be directly relevant to patient access and to profound care during this time. And so, in conclusion, I just wanted to share a final story about access to testing. So this is Dorit Morris. She also works at a nursing home. She also lives in the north end of Hartford, like the other person that I started this presentation with, and she wasn't able to get a test. And she started having symptoms early on in the process of when the pandemic began, when testing was really sparse, but she wasn't able to get tested. And so I just want to share that story as she was very sick and she couldn't get tested. And so I know this community is really interested in inmates reentry to communities. So I just wanted to share two things about inmate healthcare. And I know there has been a spike in the number of COVID-related deaths, or not deaths, sorry, COVID-related positive cases in behind bars. And so about a year and a half ago, a colleague and we did an investigation into inmate healthcare and looked at all of the requests for physician requests for different services. And what we found, what you'll see here is no, 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 no. The record keeping is to be desired. And so what we found was that about 11% of all requests by physicians, not inmates, by physicians, were denied for specialized care, as well as about 26% were unknown. So you just didn't know whether or not they were approved or denied, again, because the record keeping was really bad. And so what that says is, and this is coupled with huge decreases in funding from the state for inmate healthcare. And so I just wanted to bring that up so people could keep in context sort of the healthcare system behind bars as this is happening. So that's all I have.
Thank you so much, Jacqueline. That's very helpful information to have, and also distressing. It's not something that is wholly unfamiliar, like you referenced, to our audience, not just the inmate healthcare, but just what's happening in the nursing homes and who it's disproportionately impacting. In our first series, we had former Undersecretary Mike Lawler compare the prisons to essentially cruise ships, and it's not wholly different from nursing homes, even though we haven't seen the concerns or the deaths in prisons as they're having in nursing home. The concern is that it will rise to that, and I know we'll be hearing from Dr. Elissa Puglisi later on that. What I would also note is that rate of infection of the positive cases is interestingly mirrors the rate of incarceration in Connecticut, so that, you know, the disproportionate Black incarceration rates, Hispanic compared to white, that it's almost exactly the same. That roughly 400 or 500 per 100,000 is essentially the incarceration rate in the state of Connecticut. And you know, I'd like to bring on now Elissa, and Elissa is Johnson is originally from Lexington, Kentucky, and she's currently based in Washington, D.C. and working on criminal justice reform in Arizona. She worked in the Deep South for the Southern Poverty Law Center for nearly a decade, focusing on prison conditions and immigration detention. And the reason why we reached out to Elissa is because her organization now, Forward.us, and Elissa, it would be great to hear a little bit about the organization as well, put out a report on racial disparities in incarceration and coronavirus. And I think what this will help is give us a context of the potential for high rates of infection and the disproportionate contact for people in corrections across racial and ethnic groups.
Absolutely. Thank you so much for having me. As Andrew mentioned, I work for Forward.us, a bipartisan advocacy organization. We work across the country on criminal justice and immigration issues. And of course, during this global pandemic, people who are incarcerated across the country in prisons and jails are one of the most vulnerable populations. We know that it's impossible to socially distance in prisons. Most prisons are dorm style, and people aren't, their beds aren't 6 feet apart, and they're living, living in tight quarters. And so thinking about the current situation, there's compounding harms based upon the racial disparities in terms of the infection rates that we're seeing of COVID-19. And then you add that to the disproportionate impact the disproportionate rates at which Black and Latino and other people of color are impacted by the criminal justice system. Last week, I think this was in the material sent around, we put out a brief on the racial disparities in incarceration and coronavirus. This data obviously is continuing to come out as it relates to the number of people who are incarcerated who have been impacted, as well as the racial disparities in the communities. Just broadly looking at the criminal justice system, we know that Black people are 6 times they're incarcerated at 6 times the rate of white people, and that Latino people are imprisoned at 3 times the rate of white people. And so we're beginning this discussion with a disparity. We're talking about a disease that is disproportionately affecting people of color in places where they are already disproportionately represented in the harms. And we know that these prisons and jails, to piggyback off the comment made regarding healthcare in these facilities, is that it's oftentimes is not adequate, and that there are concerns, and that the healthcare that's available in prisons and jails is not at a hospital level. So as these cases rise, as the seriousness, the population who's incarcerated is vulnerable in part because of their age and the rate of underlying health conditions. And so as the increase of cases happens, we will see inevitably that impact our community healthcare systems, and which is why that we're, to the common mantra that we're hearing, we are all in this together. And part of that has to include looking at what is happening behind bars and how it's impacting incarcerated people and the individuals who work in those facilities. I want to share with you, I looked this morning, Connecticut is one of the states that the Department of Corrections does track the COVID cases on some regular basis. I'm not sure if it's updated daily, but as of this morning, there were 222 staff who had tested positive in the system and 308 incarcerated individuals who had tested positive. And so as we see changes and increases in these facilities, what we're seeing around the country is that those rates are rising rapidly. There's a prison in Ohio that has more than a 70% infection rate right now. We've seen outbreaks at Rikers Jail as well as at Cook County Jail. And so to circle back to how this impacts in a system that we know, given America's incarceration crisis, it impacts families, right? It impacts in America, these disparities, Black adults are 50% more likely to have had a family member incarcerated than white people. And so as we think about both the disparities in the community and behind bars, how that's impacting and the trauma and the anxiety on families and the impact as we all navigate this pandemic. In addition, we know that there's disproportionate in sentencing by race, and that Black people and Latino people, and I mentioned those groups primarily because that's where most of the data is available, are given longer sentences for similar crimes. And so it's important as we think about what is necessary in this global pandemic, that we think about the communities that are already hit harder, that just by virtue of some of the institutional and systemic biases that exist, how we have to act and make sure that they're protected to save lives. So one of the other things that I just want to highlight is, obviously I know the focus of this group is reentry. One of the things we're thinking about is, how we protect people right now, and thinking about measures such as making sure that in-person check-ins while people are on supervision are suspended. We talk a lot about the people who are behind bars, but that means that disproportionately people of color are on some form of supervision in the prison system. And so even those individuals who have re-entered their communities are potentially at risk by being on supervision if they miss an appointment or if they miss their fees of being revoked and sent back into prison. And so we have to think about, it's incredibly important to highlight the ways that that people of color are being hit disproportionately by the harms of mass incarceration in addition to COVID-19 during this crisis.
Thank you so much, Elissa. I really appreciate it and the work that Forward is doing, and it's helpful to have that backdrop about what's going on nationally, that 70% infection rate in Ohio is definitely a scary number. We haven't reached that in Connecticut, and some of that may be due to testing, but and things that we're hearing from inside prisons, which we'll be discussing later in the conversation. But if you could stay on.
Andrew, I would just say that, yeah, at the prison in Ohio that I mentioned that has an over 70% infection rate, the reason that we know that is because they're testing the entire population, which we know is not the case given the testing limitations around the country. So that's an outlier that we have that information, but it's important to know, and some of the projections around how fast this virus will spread in prisons are incredibly staggering. Thank you.
Thank you. And hopefully you can stay on for that second part of the conversation, and same with Jacqueline, because there may be some questions for you. Right now, I'd like to bring on Dr. Elissa Puglisi, who's been with us since the beginning of the series and is we're very lucky to have her. She's also in clinic often, and but is a wealth of information. And as we started this series, the one thing that we wanted to make sure is, if we're talking about a pandemic, that we have the public health voice in here, and she's kept us up to date on a weekly basis how things are changing. And so, Dr. Puglisi is an assistant professor of medicine at Yale University, where she practices primary care and addiction medicine. And she's also the director of Transitions Clinic New Haven, which is a multidisciplinary clinic that's part of a national network of programs that focus on care of individuals who are returning to the community from incarceration. So she has a special background in this population. And Dr. Puglisi, I'd love to hear from you in terms of what you're hearing with the disproportionate contact, what's happening within our DOC right now. And I know we also mentioned in the healthcare workers, it seems like every day there's a news article on unions in prisons and their concerns for PPEs and the like. And I do want to reference a letter that was sent to all the attendees that will also be on our site from I believe it was 58 individuals from Yale Medical School, School of Public Health, and nursing that were imploring the governor to do a number of things in response to what's happening in our prison and jails. And maybe you can talk about that a little bit too.
Saying thank you for having me, and thank you to Jacqueline and Elissa for those really informative presentations. I have developed a practice of sort of updating us with numbers at the beginning each week, but Elissa just gave us those. And we'll note from last week, we had talked about a doubling time of about 3 days, and that seems to have slowed down a little. But I think the real fact of the matter is, like, we just don't know. These are numbers we're putting out there, but the quality of the data matters tremendously. And this is very likely, as we've seen in Ohio this week, really the tip of the iceberg. So these are the numbers we have, but if you're kind of only testing symptomatic people, what we've come to understand is you're really drastically underestimating the burden of illness. And when Mike Lawler had, at the time a couple weeks ago, compared the prison population to like a cruise ship, in that it's a congregate sort of setting and close proximity, what we've seen this week is it's much worse than that. So on the Diamond cruise ship, the rate of asymptomatic cases, there were about 17% asymptomatic cases. What we see in Ohio is about 60% of the people who tested positive were asymptomatic. So 2/3, right? So that would tell us that, the numbers can, and the other thing I'll add on to that is that 70% of their population was positive, right? So if we look at our population, there's a lot of ways you can break down those numbers. But if you use the low end 11,000 people inside incarcerated, that's not including correctional workers and staff, the cases could be anywhere from high 700s to like 7,000. We just don't know. And so until we adopt a broad policy of across the board testing, we won't know. So I think that's a really important take home, and that's something we can be advocating for what it takes is will and kind of dedication. So that Ohio could test their prison population and we can't is not because Ohio has anything more special than we have. It's that they've decided to do it. And so we could very rightly decide to do the same. And it brings us back to, I'm a little bit repetitive, but I think it's valuable because I know that there's different people on the call each week, but I think it's really important that we frame this as a public health emergency, absolute underline emergency, urgent, and that there's a total false dichotomy between the health system and correctional facilities and the health system in the community. So though they very gravely, like we've allowed that to happen and it's been designed as such, but it's a false dichotomy. These are community members who are engaged in facilities, but there is no reason that their healthcare should be a total different version of healthcare, right? And I have collaborators in the, DOC health services, and they're working hard and trying their best. And we saw, like you mentioned, the union, the health service union, litigating because they're worried and concerned about their own health. So I think if we kind of take it all back to the public health part, I think we see that there's people across the board who are worried about their life. I mean, I think we all are, right? And in kind of using Ruth Wilson Gilmore's words, like where life is precious, if we see this as a public health crisis, and if we see our ultimate goal as saving lives, every life we can, then what's happening in the DOC is 100% relevant to what's happening in the community. Now, when it comes to disparities, I think a lot of that has been discussed already, but I'll just say that, like I mentioned last week, like none of this is surprising. This is how our health system has been built. Many argue with intention from the very beginning. And public health crises themselves, as we've seen over, centuries, they don't cause the inequalities, they unmask them. You kind of take the siding and the, sheetrock off the building and you look underneath at the foundation and you see that it's baked into the very bones of the structure. And so these, inequalities in care, in infection, in healthcare utilization, and death, they are, built kind of buttressed and supported over time. And so our work should, against, in trying to break this down, should be in absolutely being intentional that we're addressing things with that in mind. I think we have to do that. So a reentry plan has to do that. A healthcare plan has to do that. Like I said last time too, we just opened the first walk-up testing center, right? What do you think that does to inequalities? How does only having drive-up testing centers impact inequalities? I would argue gravely. Very many people don't have cars. How are they getting tested, right? And until we have mass ability to test and walk up and get tested and all of that, it's going to perpetuate these same old structural inequalities. And these are impacting Black folks, Latinx populations, Native populations in other parts of the country. Like it's the same people who have been affected by these things that were built to affect them since really the beginning of our country. And, I think that I also, though, remain positive in that I think there's a lot we could do, like a lot. Number one is how we frame our conversations when we're talking about people as a public health crisis. Number two is an absolute strong, like through a cheerleader's megaphone call for data. If we are not collecting and reporting data, we are allowing these things to happen under a shroud. And our CTDOC website that reports these coronavirus numbers is a start place, and it needs to report much more. There are other correctional systems that are reporting more. And I think that we as taxpayers have to sort of really call on more data. Like, this is stuff we're paying, and we need to know what's happening. It can't be happening behind closed doors. And then again, like, we can't repeat ourselves enough. So we're just going to organize on these calls and keep doing it, but people must be released. Every day that goes by without a drastic increase in the number of people being released is affecting outcomes, is perpetuating these disparities when you look at who's incarcerated. And as we've called for from the very beginning, right, these releases should not be picking out this like easy release, this like low level, whatever words people want to use in the criminology world. But what it's about is really prescriptive across the, we know that almost everybody who's in there is gonna come home. Now's as good a time as any. It's the best time. So you pick a line in the sand, everybody who has a year left on their sentence or less, and they're out. That would be my approach. I think it's the most equitable approach. I think it's an approach, again, that doesn't perpetuate disparities by saying, oh, people who are housed, people who, had this type of crime or that type of crime. Like, that's not what we should be talking about. It's like a mathematical thing, just getting people out. We already know they're gonna come out, 95% will. So it's like now. And I would say that every day that goes by that we're not releasing actually impacts community health as well. So as the numbers inside grow, which they are, and they will continue to, we have not seen any sign of a peak in our correctional system infections at all. As those numbers grow, there are more and more asymptomatic people who are infected who will then be released out to the community to go on and be a risk potentially to their loved ones, families, other congregate settings they're going to. It becomes an increasing danger. And so it's not only a call for release now because it's, I don't know, like popular thing to ask for. That's really not what we're talking about. This is like grounded in the science of how we know the infection is spreading, the vast numbers of people who are asymptomatic and infected, and the way that that is going to impact those people themselves and their communities. And we shouldn't forget about correctional workers, right? Like, these are people who are trying to make a living, support their family, working overtime. We just saw that report of the guy who took an extra shift, went to Manson Youth, without changing his clothes after being on a COVID unit. I have to believe that person's also kind of trying their best to support themselves and their family. And so we have to think about their health as well and see it as one big ecosystem instead of these little small boxes. Last couple thoughts, and I appreciate everything we heard from the families and personally impacted people last time, but like, there's so much we could be doing. In addition to the public health response, there's the stuff we on the ground could be doing. Our team started just sending letters into people this week to say, like, you haven't been forgotten. We're out here, we're trying, here's some good information you could use to keep yourself safe. We should be making care packages and sending stuff into people to let them know their lives matter to people in the community, and that we are working out here for them. And then we have to build like the most robust reentry, quote unquote, it's just life out in the community program you can imagine. As I've said before too, it's like, we shouldn't allow a single person really to be released without a cell phone. And in this day and age where we don't have payphones and you need a cell phone to see or talk to a doctor, leaving without a cell phone may worsen health inequalities. I'm actually pretty sure it would, right? It would, and it's dangerous. So we need to organize and like figure out a way that everybody's getting a cell phone. Seriously. And getting housed, and getting people to donate their stimulus check if they don't need it to someone who's being released to get them started. think there's a lot of creative approaches, and I'll just pause there.
Thank you so much, Dr. Puglisi. You give us so much food for thought every time. And I do want to reference that Yale letter that you are a co-signer on, and that there's 6 specific recommendations, and you referenced a lot of them. And I think the one that really hits home is, I think, the frustration probably that you feel as a public health expert is, where is our Department of Public Health? Where are the health officials in our state that are dictating what's happening across the state and not discriminating based on where people are or who they are, but making sure that it's done with an approach that a doctor would take to anybody going into their ER, hopefully. And that it should be done very thoughtfully and mindfully and as transparently as possible. And we thank you for your call for that to happen. I do also want to mention that unmasking comment that you made. I think we're finding in the collaborative as well, how frustrating is it that we have a system that releases people to homelessness. And I'm not necessarily putting that on the DOC entirely, because it's up for the community and the people that are accepting folks back into the community to ensure that they have a place, to ensure that they have a reentry strategy. And I think us at the collaborative also agree that this is an opportunity to show what reentry really should look like. And your idea of using in the Yale letter of vacant hotels and college dorms, we've often had the conversation that those are possible places where, everybody's in a holding pattern right now. There's no need to have folks jump into employment that puts them at greater risk, like we heard about healthcare workers, grocery store workers, and like. This is a chance to have people in college facilities or the like, where they can actually work on things that help them transition back to their family, their health, get ready for employment when it becomes available again, get ready for secure housing when that becomes available again. But we're going to hear directly from some voices of loved ones who have other loved ones inside Connecticut prisons. And this was put together by CONECT. And CONECT is a group of congregations that has come together over the past few years now and has advocated for humanity and dignity with regards to folks that are in the justice system. And so I know Brittany's pulling that up now, and it runs about 5 minutes, and then we're going to move on to our second session after that. So if you could play that, Brittany, that would be great.
Hello all, my name is Tanya Edwards. I currently have a brother serving a sentence.
My name is Tony Mercado, and right now I have 2 family members that are incarcerated, my son and my husband.
Hi, my name is Mona Lee, and I'm doing this video for my son, Melvin Wells.
My name is Juno. I'm making this video in regards to my brother, Albert Lee, who is currently incarcerated.
My name is Aqua Crooks. My father is incarcerated, and although I do get to speak to him from time to time, there's nothing like having an in-person conversation with your dad.
My name is Margaret Nelson. And who is your loved one behind bars? And I tell you, it's my son. What do I miss about him? Every single thing. Everything. Everything.
With the new coronavirus pandemic, I'm actually very uneasy with my brother being in there. Usually we talk maybe once or twice a week. Haven't spoken to my brother in a while because of the corona and it being on lockdown. I know out here in the free world, we're taking a lot of precautions as to how to be safe. But I did see on the news that there is a lot of people like POs and inmates actually testing positive for corona. We're not able to know if the precautions that we're taking out here are being taken in jail.
With the spread and the pandemic of this COVID-19, we are freaking out. We are very, very scared about. My brother has a weak immune system. He has asthma. He has high blood pressure, and we're scared.
They cannot practice social distancing. They're not giving them masks, gloves, or nothing. They're taking their clothes and trying to cover up their faces.
I'm very concerned for him being in Osborne Correctional Facility because he is highly asthmatic and he has other health concerns that can be an issue if he was to catch the coronavirus. Speaking to him while he's incarcerated, he is scared and nervous that this will one day be his future. Although I know he committed a crime, I do not think he should be punished by an illness or, at worst, death.
The whole situation just has me very, very uneasy. I'm very worried about my brother. His safety means a lot to me.
My husband, he caught the COVID-19 virus and I wasn't informed. I had to find out through an inmate search because I wasn't hearing from him after 11 days. And that's a scary thing, to find out your husband has been transferred to another facility where all the inmates are being transferred that have the COVID-19 virus.
What are my fears for him? That he might die in there. That he might die in there. There's got to be a way that this governor could do something about it. I think I would like for him to understand, had the shoes been switched or if he'd been in my place, would you do this? Would you just let people just die in there?
I do believe that they should be treated as human beings, and then they're not.
We really need him to come home for the sake of his safety, our sanity, and our love.
Have some kind of alternative for the guys that are incarcerated.
Just because these men and women are in jail, their lives matter. Their lives matter.
They are somebody's husband, somebody's father, somebody's child, somebody's brother, somebody's uncle, and we love them. And if you want us to practice social distancing and things out here and good hygiene, you should do the same, for them in there. Please help our family.
I need my son home. I need him home. Governor, if you ain't never did nothing else, do this. Send these people home.
Know that they're on. I mean, for me, that was a very hard video to watch. And I know that was hard for you as well, Robin, because for all of us and everybody that's on this call and people that join us constantly, they understand that this is a human issue. This is when we start to talk about race, today the whole conversation was heavy for me. I really appreciate the data and the numbers, having been incarcerated and having been one of those people on the other side of the fence and, not knowing, what next to expect and then being sick in there, just having a regular cold behind bars is one thing, man. But, with COVID killing people, I've lost a lot of friends and family members as of late, and this is scary. And to be a Black and brown person, to be an African-American male with no health insurance, very little health insurance. You know what I mean? I'm very nervous about, how things could proceed. So, Robin, did you want to just chime in and, we can have some conversation and while people are, on the call, I really appreciate today's topic, shedding light on the fact that, this is a serious issue. And I wanted to just add one point that, I have a lot of Latino friends that, when I was incarcerated, and, sometimes, some of my friends that were, Latin were, due to whoever was checking them in, they would pick white or Hispanic. And, so I would even question some of the numbers that we're hearing that are reported, because sometimes, if it's up to judgment, somebody could say, oh, you look this is what we checked you off as. I don't have that luxury with this dark brown skin. So pretty much every time I walk into the room, pretty much people know I'm Black. Did you want to chime in? Except for when I was in DR.
Sure.
When I was in DR,
Sure,
I definitely was mistaken for something else. But go ahead, Rob.
Yeah, had that experience as well in DR, but
Yeah.
I mean, it is definitely heart-wrenching to have to watch that video and to know, you know, from firsthand experience. It's not just a matter of the work that I'm doing as a legislator, but I mean, I do have friends and family members that are actually incarcerated right now and getting calls from their sisters and their aunties, you know, asking for me to check on them. They haven't heard from them. I think the thing that has been really hard to stomach is that we get these reports, and then when we go back and we talk with DOC, they are rebuked, and absolutely that is not the case. That is not happening. So there is that dilemma to deal with, you know, from knowing on the ground what we're hearing from inmates and having people send me videos where they are actually on the phone with their loved ones, and I can hear the conversation through the video, and then to speak with, you know, officials at DOC and have the allegations denied. I tell you, COVID just really puts us at a disadvantage because the prisons are locked down. The state is pretty much locked down, and it has stopped us from being able to do the very in-person things and popping up and those sort of kind of checks and balances that we had opportunities for no longer exist. So it just makes it really hard to get a grip on it. And I applaud Ohio for taking the bull by the horn, so to speak, and testing every single inmate. You know, that is part of the conversations that we have had in talking with DOC. And, you know, of course, we hear we don't have enough tests, we can't do it. But when you look at the fact that 70% of Ohio's population was tested and 60% of them were asymptomatic, that should not only sound the alarm for what's going on within our prisons and our detention centers, but it should also sound the alarm on what's going on in our communities, in the general public population, and should really be changing the way we're talking about slowly reopening the economy. Definitely have a problem with that. But that is the thing that I want to talk about. And there was one thing that I missed that I wanted to see if we could go back to when Dr. Puglisi was talking about, she made an unmasking comment that Andrew referred to. What was that about? Is Dr. Puglisi still with us?
Yeah, she's still with us. She's answering.
I'm here.
Hey, Lisa.
Hi. That was just me saying that I was just commenting that this public health crisis and having associated health inequalities is nothing new. It's not from the public health emergency. It's not because of COVID. It's due to the deep structural foundational system that is unequal and supports these inequalities. And so I was just saying they're not sort of like COVID inequalities. They are societal inequalities, which are unmasked during the time of COVID and that we saw during Katrina and during the 1918 flu pandemic and all of that. It's the same thing on repeat.
Gotcha. Thank you for that. And I most certainly do agree. You know, it has exacerbated what has always been. This is nothing new for Black and brown communities, especially Black communities. This is century old. It's deja vu, and it's really on height right now. It's very blatant, and I think I would really like for us to start thinking about messaging and a narrative and actually action around what is going to be the response in communities of color where we are being disproportionately impacted. There's great concern around that, and as we come out of this epidemic, this pandemic, which we will, how do we want to do that to ensure that, you know, the solutions that we're using right now, all of a sudden we're making exceptions? How do we make sure that those exceptions become the rule, and that, you know, we don't have people that are homeless, that we are not releasing our justice impacted people to homelessness, right? Now we're working together in partnerships to make sure that these folks that are being released have somewhere to go. We also need to make sure that as they're being released, and this is what I talked about on the call, they need to be tested. You know, I got communications from a young lady whose brother was released, and 3 days after being, you know, with her as a sponsor, he had a fever, they had to quarantine him, and eventually she had to ask him to leave the house. So even though we say, we're putting them in safe places, in sponsorships and halfway houses, wherever we're placing them, with them coming home sick with no method of self-isolating or quarantining for those 14 days, it is what you said, Dr. Puglisi. We are actually putting the community at risk and heightening, the COVID, the contagion of COVID through release. And we're trying to fix a problem, no doubt. We're trying to get people out, but we need to make sure as we get them out that they are being released into community or homes in a way that is safe and protects everyone, not just, themselves.
Yeah, I appreciate that, Robin. I know that we have State Rep Bobby Gibson on the line. I will go to him next. It was interesting. We had a call the other day. I was talking to someone who just was released or about to be released from the federal system, and the family, and he's being released due to COVID. They're putting him under home arrest, but before he goes home, they are holding him in like a halfway house type of situation for 14 days before he returns home because there's a small baby and his mom is elderly. And I thought that was a pretty cool situation that they have the opportunity to do that instead of, because family was like, well, we thought he was coming directly home. And they said, no, that he has to stop. It's like a kind of a stopover to make sure that he was okay. And, I know we got a lot of advocates on the ground and in the cars blowing horns and doing a lot of things. But once again, I emphasize we need to know what our asks are. We need to really focus on what our asks are. Just asking for release, we're going to get people that are released with no place to go. We need to be focusing on where they're going and how they're coming home. I will go to Alana. How are you, Alana?
Hi, how you doing?
How's it going?
Yeah, thanks so much for including me. I defer to everyone. Everyone else is on the ground and doing and talking to people. We're, as you know, in the midst of now 2 lawsuits, a state lawsuit and a federal lawsuit.
Right.
Pleading with the courts to take the urgency of this seriously. And we've fashioned various requests for relief, including release, but also including improvements to just the daily hygiene, sanitation, what's actually happening in each facility, which seems to differ tremendously.
Right.
Happy to, talk about anything that is helpful. But again, echo really everything that's been said on this call in terms of just the really terrible and tremendous impact on people who are incarcerated right now of this pandemic.
Sure, I appreciate that, and we may bounce back to you. Just one of the things that we were talking about as a community, because this is a community issue. I know that we're hearing from a lot of people that soap is an issue. If soap's an issue, then we need to be able as a community to bring as much soap and cleaning supplies to the facilities, and however they need to check for security measures, that should be possible. I know I used to work in the hospitality business, and the hotels used to donate boxes of that, the soap that they put in their rooms. I think that we need to be focusing on that. If soap is an issue or getting it there, whether it be transportation, I think that, as a community, man, we could get more. I got enough friends that I could fill probably every prison in Connecticut with soap if that's the call to order. So we really need to be focusing on what is our call to action. We really appreciate the legal work that you're doing, but we also want to encourage people that are on this call. I got 150 friends on this call right now, and we need to really start focusing on our call to action.
Dara, I'm wondering if Elena can give a sense of what those lawsuits are and what's pending and the timing of that, because one of the things that may happen is if they rule in favor of the council there, then there may be a situation where a lot of people are eligible for release all at once, and that exacerbates the need for a plan. So I wonder if we have a sense of timing on that.
Exactly. And what's the ask as well?
So just, to fill everyone in, on April 3rd, several law school clinics at Yale Law School, along with the ACLU of Connecticut, filed a state lawsuit in our state superior court, along with the declarations of 3 different public health experts saying that the only way to keep people safe who are incarcerated right now is to de-densify the prison system. That means releasing people on an expedited basis and, not one by one, not a trickle, but, a lot of people. We focused on people who are end of sentence, people who are medically vulnerable, people who have already qualified for transitional housing and other statutory mechanisms. So that lawsuit was filed April 3rd. We are still waiting for a decision from the state court on the kind of first hurdle that the state threw back at us. In the meantime, we have filed a federal class action lawsuit. It's focused a little bit more on medically vulnerable people. We have it's a class action, so it's on behalf of everyone in the prison system, but there's a subclass of medically vulnerable people saying that those people must be released urgently to the extent they can be safely. And we've also kind of renewed the focus on conditions. I've spoken to now dozens of people with my colleagues. I think we've spoken to almost 100 people in different facilities, and it is terrifying. I mean, I'm sure as everyone on this call knows, to hear what's actually happening. Not the DOC policy and not the kind of rosy portrait of everything is consistently fine, and we've given everyone their bar of soap and everyone has bleach and it's all great. Right. But actually what's happening facility by facility. So we're really trying to bring that focus in the federal court action and say, God, at the bare minimum, let's get the cleaning products that we need in every facility right now. I wish I had a good sense of timing. I mean, we have done this on the most urgent basis. We're using every tool at our disposal on the legal side in complement to the great advocacy that's being done outside the litigation. I don't have answers on timing. God, I hope it is. I hope it is soon, but I really can't say.
I really appreciate that. The interesting thing, when you're incarcerated and you don't have family members advocating for you, you're a lot of times, your wants go unanswered. But if you have that family member or that mom or someone that's making that call, that the squeaky wheel gets the grease, and so we're out here advocating for all those squeaky wheels. Those that don't have those people. So I really appreciate your work that you guys are doing on that side, on that front. Yeah, I was just double checking, like, as like you mentioned, a lot of us are hearing those conversations that, I had a call the other day where someone was able to record the conversation with their loved one, and they literally were crying because this person was like, they were scared. And, I put my hood hat on today and say, this is a hood dude. This dude is normally not scared. And, a lot of people are saying, you do the crime, you do the time, and I agree. You know what? I'm never saying that, people shouldn't be accountable for their actions, but nowhere that I know of somebody went to jail for 2 years or 3 years and ended up with this death sentence or was, at risk. Like if you were told that you'd be at risk of a virus that could kill you and, during your 18-month sentence or something like that. A lot of family members are scared. And I think that, all of us, need to always try to, help these individuals with, more clarity and information as best as we can. I like that we have an opportunity to work with DOC and get some of the information, but every day people are asking for more and more and asking for individual information. My son has asthma, he has some psychiatric disorders, and then they just moved them and so on and so forth. So there's a lot of fear and uncertainty going on behind the wall.
Well, I think, Darryl, the thing you said is really poignant, and we need to speak to that, and amplify voices around the fact that people say, you did the crime, you do the time. And that is the truth. You do the crime, you do the time, but let us be mindful that doing the time is the loss of your freedom. Incarceration is the punishment. Loss of freedom is the punishment. The inhumane treatment and the torture is not, part of the sentencing. And, thanks to Senator Winfield, we did away with the death penalty in the state of Connecticut. So a sentence should not be a death sentence. Right. And, I always say if it wasn't a life sentence going in, it shouldn't be a life sentence coming out. Well, it certainly shouldn't be a death sentence because that no longer exists here in the state of Connecticut. And, there are precautions that can be taken and should be taken to ensure that, these people, these human beings, these loved ones, members of our community, my and our, my colleagues, constituents, these people deserve the same protection as everyone else, and it's just like they say, we're making sure that the free world is taking all these precautions, and in some instances, those precautions are not feasible in these congregate care settings. So what do we do to alleviate that? And I say, some of these universities that we're using, we have plenty of state universities right now that are empty, that have dorms, that have cafeterias. We can set up, some kind of housing for them that will hold them in the meantime, in between time, until we can get them permanent sponsorship or permanent housing, but this can be the bridge that fills this gap that we say is the problem, and a very unique and valid concern. We should be taking precautions as we release folks, so that we don't, create a bigger situation trying to, man the smaller situation, which is not a small situation by any means. But
Right.
You're right on that.
Yeah, and I agree. And a lot of people are saying, well, who's going to take care of them? We'll take care of our own. I got churches and aunties and all over the state that are willing to cook whatever they need to cook and bring stuff to these people. So we will take care of our own if we can get them to a safe place. I really appreciate that. But I'd be remiss to not mention that those DOC staff members that go in there every day who wear blue, who don't wear tan, that our friends and family members of mine also are at the same risk. So we're talking about in making a safe environment. We're not just talking about those in tans. Of course, I represent those in tan, but I also have friends and family. So when we talk about this group, we're talking all the way around. We need to make that system safe for individuals.
I agree.
Nobody signed on. You filled out that application, but you didn't sign on to die at that job.
My job and my passion, grassroots wise, has always been fighting for the most vulnerable people, and our justice impacted folks definitely fall into that category. But my concern also lies with the workers, right? Not just
Absolutely.
Our correction officers, but our mental health supports, and our doctors and nurses and psychiatrists and counselors and administrative folks and faculty. All these people, anyone that steps foot into a facility is at risk. But on the other side of that, I also want to express the fact that, the population was not infested. You know what I'm saying? Like, they were not COVID positive. COVID was brought in from the outside, which has created this fear, and a legitimate one. The fear is legitimate. We just have to figure out how to channel it in a way that's going to be positive and conducive with saving lives, right? We can't let it debilitate us.
Right.
But the concern is that it is community, because these folks are going to work and they're coming home, and most of them are going home to their families, which puts their families in jeopardy. And these folks are still going to the bank. They have to go to the grocery store. They have to go to CVS. They're going to pump gas. We're in contact, and everybody's not respecting the social distancing and the 6 foot and the mask. Hopefully we're getting to a point where that is going to be the case, but we know that's not the case currently. So this is not just about fighting for the rights of our justice impacted people who are currently incarcerated. This is about fighting for everyone, because we are all a part of this. This is about everybody.
Right.
And I just want to make sure that when we talk about it in that fashion, because we bring more people on board when we message it like that.
Right. It's interesting. I was talking to one of my friends that work at DOC, and I was talking about the door system. When you walk through the door when they go to work, each and every one of them have to touch that door, coming in or going out. Like everybody, there's one door that every staff member has to touch. It's not like multiple doors. So they all have to go in and out through that door. And those individuals that work in the units, they're touching this or touching the phone, they're doing all this stuff. So, all it would take is one or two, asymptomatic people to be in there doing their normal job, not feeling any symptoms, and then that tends to spread and continue to go like wildfire through there. I've been, like I said, on many other web series, I've been in there when I've been in this institution when things are going around, and it's not a pretty sight. So, you know, we have an uphill battle with them, but right now we need to be focusing on what it is that we can do, what it is that they can do. I always go back to my CSI, community system as an individual. The community has a responsibility. The system has its responsibility as well as the individual.
And this is from Representative Gibson. And he says, my statement is we as legislators are advocating for relief, but also for the racial breakdown of inmates being released. We have asked several times on various calls for racial breakdown numbers of inmates being released and have got nothing. Also, it's unacceptable that correction officers are not being mandatorily required to wear PPE. They are other COs who fear their health because other COs are not being safe. End of quote. And that has certainly been a part of our conversations with DOC and leadership and the governor's office, and it makes perfect sense. We do have COs, and I have people that are working, mental health workers that are contacting me, you know, about their concerns around contagion and the lack of PPE, the lack of sanitizing. But when we're on the phone, we're being told that they are doing an extensive sanitizing run, you know, daily. So these are the conflicts and these are the frustrations, you know,
Robin,
because—
can I ask you a question about that?
Yes.
It's Lisa. I'm just wondering, you know, to that message that you read, which is a very real one, a lot of the problem around PPE, beyond just getting it, making sure that people know they should wear it, is actually getting it to them. So it would be very helpful if we were able to get a daily or weekly report on the status of PPE in the Department of Correction. And, you know, one of the problems is that because correctional officers are not classified as frontline emergency response workers, their health needs are not often prioritized in these sorts of actual emergencies. And so an action item can be, how do we get PPE into the DOC? First, we need to know what the status is and what they need, and then we need to know how to get it to them, or what we could do at the state level to support channeling some of this PPE to them.
Right, I appreciate that, Dr. Puglisi. Only reason, I'm sorry, Rob, I just wanted to say that, you know, there's quite a few brothers that I know that are not, no matter what the situation is, considering their crime and the time, they're not getting out. So we need to definitely be speaking to protecting them as well, because many of them have, you know, very large sentences, and that I know that they don't fit the criteria that we've been seeing of release, regardless of their age or health issues at this time. So I think that that's a very important thing, and that's something that we would definitely advocate for and try to find funding, you know, especially at the level 4. The level 4 facilities where individuals are not, you know, some of them are not getting out anytime soon. Sorry, Porter.
Yeah, and I think the other thing is when we look at McDougal, because it is unique in the fact that it also serves as a level 4 prison as well as intake. It's the assessment stop for every person leaving a city or town jail. They're sent to McDougal and they're held there until they go through this assessment. And some of them stay depending on what their sentence is, and then the rest are like, you know, sent out to whichever level prison their sentence mandate. Right. So that has also been a call to action because of the traffic and the intake at McDougal. They and the jails at the local level are really where I feel most of this impact is being felt.
Right.
So you make a valid point.
Right. To make the correction that it's usually, unless things have changed, the assessment part is Walker, which is attached to McDougal. So McDougal, I don't want our friends that are on the call to worry if they have loved ones in McDougal, but they are 2 facilities. Walker is the assessment facility where anybody with, the way I understand it, unless it's changed, if you've been sentenced to more than 2 years, you have to go through assessment which I've been through it more than I like to admit, and it was not pretty then, so I can't even imagine during COVID. And McDougal is the facility behind it, but there could be some transference between COs, there could be a bunch of stuff, and then some of those inmates that come out of Walker may end up in McDougal as well. But the assessment piece is Walker, which is Walker McDougal if you look on it, but they are two separate facilities, just so we make it clear for our friends and families so they don't get another thing to worry about, already worried about their loved ones that are incarcerated. We want to make sure that we give correct information. Thank you to Rep. Porter. Is there anyone, I really appreciate Rep. Gibson's response. That was very powerful. Elissa, did you have something that you wanted to add to the conversation?
Hey, Daryl.
Yeah,
I have a question from the public. I'm sorry to cut you off. This is Brittany. Someone's been asking me this for quite some time, and I want to make sure that Rep. Porter gets asked. Rep. Porter, I have someone asking, will the legislature, when they reconvene during special session, deal with any of the issues we are talking today about? If yes, what are the priorities?
There will definitely be discussions going back into session about the exceptions or lack thereof that should actually be a rule of thumb moving forward so that we don't have to go through this again. Because unfortunately, we know, it's going to happen again. And the priorities are just mainly what's coming out of this, like the fact that people need to have the right to be protected in the instance of an outbreak. We need to look at, which we are looking at, and this came up on the call, there has been a tremendous effort on our parts to get people released on a compassionate release, but there's also a medical release. And we need to make sure that going forward, because it's so strict and stringent, that it is relaxed. And we will probably have to address that through legislation so that in future attempts to get people out that are medically compromised and are near end of sentence and, have certain situations of vulnerabilities that would make them more susceptible to catching COVID and dying from COVID. We're looking at all of those aspects and how and what we need to do to legislate to address those issues so that they're not roadblocks and barriers going forward, because that's mainly what we're running into. We're having statutory language thrown at us now in a way that shuts down the efforts that have been made. And to give you an example of that is, we were on the phone with DOC Commissioner, and we were told that he sent 30 packets to the Board of Pardon and Paroles, which is Chairman Giles' operation, and they are in charge of the compassionate and medical release portion of dealing with the inmates. And DOC has kind of said, we sent it over, and out of the 30, I asked, well, how many have been approved? Out of 30, we have one person that has been approved for release right now. So my question to them then was, okay, if you're going to stipulate statute and say how strict it is and how that is what's keeping people from being released, can you at least tell me that the 30 packets you sent over qualify according to statute? So that's what I'm waiting to hear a response on. Because if that's not the case, then it's been a moot point for you guys to be sending packets, quote unquote, over to the Board of Pardon and Paroles requesting review for release on compassionate or medical basis. So those are some of the things that we're looking at addressing legislatively when we go back.
Thank you. As always, Rep. Porter. So it's a pleasure. I think Andrew was going to jump on, and then I think Elena had one more comment.
Well, if Elena has one more comment, that'd be great to hear from, and then we'll do a quick wrap up and let you know what's happening next week and a few other things as well. So Elena, and also please introduce yourself, because I'm not sure everyone knows who you are on the call.
No problem.
And my apologies for not introducing you as well.
No worries. I'm Alana Bildner. I'm a staff attorney at the ACLU of Connecticut, and thanks for letting me hop on here. I was just going to echo Dr. Puglisi's call for transparency. I think one of the most frustrating things here is that we know right now that there are outbreaks in many, if not all, DOC facilities, and some of them are really bad. But as this goes on, DOC has provided less and less information It's taken away the, facility by facility numbers of positive people. So we don't know, in real time which facilities are having outbreaks. We only hear it on, anecdotally. It's taken away the numbers of people who've gotten tested. So we don't know the total testing versus the, positive cases. It doesn't make sense just on a basic level when DOC is clearly dealing with something and it's over its head. It can't handle this. It's under-resourced and understaffed on the medical side. We all know that going into this crisis. Why, instead of trying to deal with it on a global, comprehensive level, its response has just been to try to kind of hide how bad things are. I think everyone has been feeling that frustration, especially because people on the outside have the ability and have offered now to help in various ways before this gets totally out of control. So I echo the call for transparency of data, transparency of what's going on in facilities. To the extent people can push for that, that's what we need right now. And I thank the supporters and allies in the correctional workers unions and the medical healthcare staff who've supported all of these efforts, who kind of just jumped in because they realize that at this point, correctional health is public health.
That's right. That is so true. Real quick, I got a text from Representative Gibson, and I just want to mention that he says we will question that if we can release some inmates early now during COVID, then we need to take a look at sentencing reform. So that is definitely another big part of the response to the question that was asked earlier about when we go back in the session, what are we looking to do legislatively? And he is speaking to the need to look at sentence reform.
Right. And I think coupled with that is his point as well about who's being released, because we know a lot of the discretionary releases rely on a sponsor. And if you don't have a sponsor, that means you may be staying inside until one becomes available. And oftentimes that might be a halfway house. And right now those are, all filled up. So that's why I think that call from Yale and from others, from you, Representative Porter, and I know the roundtables have said it about other opportunities for release to appropriate places that we could utilize right now in the moment is so important. And also providing those wraparound services so that we can show what reentry means. And successful reentry could be the support of the community, the support of the institutions, and we have an opportunity to show that. And I know there's been a concern about release in the past because there's a recidivism rate. People come back. We can show how to do it right, and I think we have an opportunity to do that. And I think we're just asking to be a part of that. So I think to thank
Andrew. I just wanted to just something that I heard Dr. Puglisi said, and it's something that that I was like, wow, it was very powerful that she said it, because it's something that we say every day. I'm trying not to be bit by my daughter's puppy as I'm talking, but she was talking about the robust reentry process, and Rep. Porter, I'm hoping that that's a conversation that we can continue after COVID with your colleagues, because it's clear that we need a community-focused, robust, more, idea of what reentry really looks like in Connecticut. I've always said that Connecticut does a real good job at many things. Reentry is not one of them that we do well. And it's clear through the COVID that reentry is not at the top of many people's lists. Reentry isn't even talked about enough. I think we talk about it every week, and I think that we need to talk about it more. And what does real reentry look like? Releasing people is not reentry. I have a couple of friends, who have served 25 years, and they were scheduled to go to halfway houses, and now they're scrambling to maybe be released to their family members' houses or whatever, and they want to get out. After 25 years, they want to get out. But understanding the fact that, if you planned and you did your 5-year plan and you did your work, and your part of your plan was going to a halfway house, and now all of a sudden that's changed, can you imagine how overwhelming it's going to be to have to do 25 years, then get out, and now you're on a family member's couch? Yes, you're released, but that's not what reentry looks like. Reentry is full services, wraparound services, and everything. I see Senator Winfield just joined the call. I know in respect of time, but if he had a couple of comments that he wanted to make, we always have time for you as well, Senator.
Thank you. I appreciate it. And sorry, I was having a hard time getting on. I think your comments about reentry are extremely pertinent. I know that I've had some conversation with you about it. I was beginning to have conversations with Andrew about looking at reentry in a different way than we currently do along the lines of what you're talking about. So that's very much an issue I'm going to try to bring before the Judiciary Committee. In answer to the question that Robin did an excellent job of answering, we will certainly be looking at what has happened, the DOC's response, BOPP's response, and judicial's response to the people who are in the system. And every day we're still trying to get more questions answered. One thing I just want to point on touch on really quick that I think is disturbing is that the way that the questions have been answered as it relates to those with medical conditions allowed the public to believe for a very long time that if your family member had issues that could contribute to comorbidity, issues that might medically compromise them, that there was a chance that they would get out. But as Robin pointed out, the two statutes we're talking about, one which requires you being 6 months to end of life, and the other one incapacitated and assessed to a certain degree where you're already incapable of being a harm to the public, don't cover the majority of people that we're talking about. And so allowing that to sit out there is beyond disturbing to me. And I'm still engaged with the department and will be making some statements to clarify for the public what's actually going on.
No, and I know Senator Winfield that they had that conversation in the Sentencing Commission, and Sarah Russell, who was on a previous call, talked about compassionate release and how narrow that is, and there's a possibility to look at that, and I know they've been working on looking at other language for that. The other thing is we watched the CONECT video, and they mentioned no executive orders, although there has been an order put forth by the Board of Pardons and Parole that would allow for 18 months prior to the voted to parole date that someone be released. My understanding is right now they're still only doing parole hearings 6 months prior to the parole eligibility date. So there is a wide window and a wide berth that's possible if the board were motivated to do it, is my understanding.
Discovered during the hearing we had this year to try to get some more people out of the system with the bill we were running was that the disposition of the BOPP is that certain people shouldn't even actually be before them, right? So there's there are a lot of parts of this that we really need to do. You might hear my kid in the background. We might need to do some exploration of, and I will assure you that if I return, we will be doing that exploration.
Great. Well, thank you so much, and I think we'll wrap it up unless anybody wants a final word. All set?
No, I think the only thing, Andrew, is something that we are working on, and Senator Winfield led the charge on this and brought a lot of the BPRC members and others on board around making sure that we collect data as it relates to race and ethnicity. I've asked that zip code be added to that compilation because I believe that is extremely important. We know where these people live and how they're being impacted, but it needs to be a part of what's being reported in the data. But back to just reemphasize what Representative Gibson was saying along the request for DOC to report to us. And when I asked them that, I asked them for the simple fact that the majority are Black and brown bodies. And if we're asking for a release, it would only make sense that the majority of those releases would be Black and brown bodies. And if we're seeing anything other than that, then we really haven't addressed, like Dr. Puglisi said, the pre-existing, situation where there's always been disparities when it comes to people of color. So I just wanted to end on that note that the data is everything as we go through this process, and we need to make sure that not only are we collecting the data, Senator Winfield again made a good point, we need data points like, okay, so these are the Black and brown people, how many people in total? We got to make it relevant data so that we can really be effective moving forward when we go back in the session to make these legislative changes to advance us for the future. Thank you.
Thank you. And I know one thing that the Reentry Collaborative is doing is starting to break those data points down by where people are being released so that we know how many end of sentence per month are being released to New Haven and what their situation is, and can we work with them 6 months prior so that they're not going to be homeless, so that they will be connected with their family members, so they will have health plans and the like. And, you know, hopefully that moves beyond end of sentence. But I mean, I think we've all been frustrated that to date, we've kind of been stuck on go for about 20 years on how we measure people being released from prison. And it's really just on failure rates. And we're not looking at what are the positive measures that people are getting themselves into. Like, I know you're so interested in, are they not just employed, but is it a livable wage? Is it not just a residence? Is it something that is more permanent and sustainable?
Do they have health care? You know, do they have the medical supports that are needed? And the other thing that we haven't talked about, Andrew, is the mental health aspect of this and the supports that people are going to need around the stigma and the trauma that they're having to deal with, especially folks in congregate care.
That's a great point, and I appreciate everyone making it. And I think that, you know, I got to make my plug as well, is that the reason how these things get forgotten about or are last minute thoughts is because, once again, a lot of these decisions are made by people who do not have the lived experience, who have not experienced reentry, have not experienced poverty. A lot of these decisions are made. You leave your house, you know, no one's knocking, a really good education. I know they're expensive. I have student loans myself, but understanding that if you come from a certain demographic, how are you going to make decisions about other people that you have no knowledge of? You've never lived in the projects. You've never re-entered from a prison cell, but yet you're leading organizations and you're saying that you're a leader in this movement, yet you do not have one person with lived experience on your team. When decisions are made and funding decisions are being made, there are no people that are with lived experience being consulted. And I ask my friends, I know Rep. Porter and Senator Winfield, you have always included us, but we need to be included more, and not just me. There's many more that look like me who have other experiences. There's new ones coming out. Can't wait to get out and get involved in this walk. So we need to really be focusing on, if there's a funding decision being made, people with lived experience need to be a part of that conversation so we're not dropping the ball. Thank you for everyone that joined us on the call. Andrew, I always throw it to you for the last closing words. And once again, we thank everybody for joining us.
Yes, and I thank you so much, Daryl and Rep. Porter and Senator Winfield. And I'd like to also thank Jacqueline Rob Thomas from the Connecticut Mirror, Elissa Johnson from Ford, Dr. Elissa Puglisi from Transitions. One thing I'd like to let everybody know is that we are going to be doing, we announced it last week, but we finally got it up and going, in connection with Representative Porter, potentially members of the Black and Puerto Rican Caucus, with the Commission for Women, Seniors, Equity, and Opportunity and Yale Law. We'll be hosting a virtual screening of Worst of the Worst, which focuses on Northern, and having a discussion after that. The reason being is because, as the Yale letter mentioned, as we've heard in a lot of calls, is that Northern is where people are being sent when they're sick. And there's a real question about the ethics of that and the efficacy of that. And we'd like to have that open conversation. So that will be Friday at 3:30. Look for information on that. And then next week, we will be focusing on the future next Wednesday at 10 a.m. And we will have someone, prison director from Norway. And it will be, I think everyone will find a fascinating window into a world where we've talked about dignity for all, where some of it is actually represented in the actions of the way society is treating prisoners in Norway. And one final thought, it's Earth Day today, and you know, our expression for reentry reform is dignity for all, and I think that dignity is also for the earth. And I'd like to, you know, one of my thoughts has been, and it's not mine alone, but the way that we treat folks that are in incarceration is often the way that we've treated the earth. And if we could only do a better job of understanding that we're all on this planet and we're all going to survive depending on how we treat each other and how we treat the earth, we'll be much better off than if we think things are throwaway and will never come back to us. So just one final thought for Earth Day. And you know, I walked in this morning out in Hartford, and it's been the cleanest air that we've had in my 20 years of living here. And so there is potentially a silver lining in all of this. So thank you all for your thoughts, and we really appreciate your joining us. And we'll hopefully see you next week, if not Friday.